Christine Schneider, the visceral voice.
Welcome to Season 2 of the Visceral Voice Podcast. I'm your host, Christine Schneider. Every week on this podcast, I talk with voice specialists, manual therapists, health specialists, psychotherapists, movement practitioners, and professional voice users about voice science, function, medication, movement, puberty and aging, and everything in between. I am on a quest, not only to become a better manual therapist, but also to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, and a manual therapist. Join me every week as we strive to provide current, knowledgeable, creative, and compassionate information to help restore, regain, and create happiness and success on your vocal journey. Columbia professor Jeanne Goffi-Fynn is an active performer and teacher in New York City. Dr. Goffi-Fynn is the director of the doctoral cohort program in the program of music and music education at Teachers College, Columbia University, where she received her doctorate in music and music education. Previously, she was on the faculty of New York University, the New School Actors Studio MFA program, William Patterson University, and the American Musical and Dramatic Academy. Dr. Goffi-Fynn has extensively worked in the area of vocology, specifically in the area of retraining of singers. She has completed an internship at the Grabscheid Voice Center, Mount Sinai Hospital in New York City with Dr. Linda Carroll and Dr. Peek Wu. She has also trained at St. Luke's Roosevelt Hospital with Dr. Anat Kadar in the diagnosis and treatment of singing voice disorders. Dr. Goffi-Fynn credits the beginning of her teaching career to Dr. Barbara Doscher, with whom she studied voice and pedagogy at the University of Colorado at Boulder. Today, I sit down with Jeanne and we talk muscle tension dysphonia. Here you are, my conversation with Jeanne Goffi-Fynn. Hi, Jeanne. Welcome to the podcast.
Thank you, Christine.
It's wonderful to have you here. I really appreciate you coming on the podcast and talking with me today. So you are the director of the doctoral cohort program in the program of music and music education at Columbia University Teachers College. Is that right?
That's a mouthful, yeah.
It's a mouthful. I was tripping over myself a little. And you work in the area of vocology, specifically in the retraining of singers. How did you get into vocology?
It was interesting to think about this. It has been a while. I had been singing in Europe and went back and worked with Barbara Doscher. It's all these sort of back and forth. Then I went and was singing again, developed some asthma and allergies, took time. Anyway, I was back to teaching and singing. But one of my first teaching jobs was at AMDA, the American Music and Dramatic Academy. And this was sort of before we were really teaching a lot of belting. A lot of singers were getting nodules. And I sort of was taking them on because I sort of had the background of anatomy, physiology to talk with the doctors and sort of see what was happening. I really take that as that was my moment when I started to look into more closely, not just the music theater voice, but also what are these issues in terms of production and injuries of singers. So that was the start. And then I just followed different pathways, met different people. So I did an internship at Mount Sinai with Linda Carroll and Peek Wu, which extended, and we still collaborate together. And then I did a long extended time working with Dr. Anat Kadar, who was part of St. Luke's Roosevelt originally. Mm-hmm. So just constantly learning more about the voice, learning more about these injuries, learning about the retraining, and being part of a team approach. I mean, that's what I really got working, particularly with Mount Sinai, that Dr. Wu would say, what do you hear here, Jeanne? I don't see anything, that the scope is not revealing that much.
Mm-hmm. That's so great. So we are here today to talk about muscle tension dysphonia, or MTD. As far as I know, you've done a lot of work with MTD. So let's start by saying, what is MTD?
MTD, muscular tension dysphonia, is basically when the vocal system is out of whack. So if you think of the voice having three systems in terms of the power source, the vibrator, and then the resonance, that system can get out of balance. And then one system, they don't work well together. They're not collaborating. One system is overworking. And in MTD, the system tends to get bogged down right at the source, if you will, at the laryngeal level for a number of reasons. If you think of it, there being the primary and secondary, we didn't used to talk about it like that, but that's how we're talking about it now. So the primary is there's no pathology. The vocal folds, in other words, are healthy, but the functionality is not efficient. And we see different ways that happens. Sometimes there's the gap in the back, which between the arytenoid is usually from a higher laryngeal positioning. But we also see sometimes good closure, but additional squeezing in the supraglottic tract. Sometimes it's the constrictors. That's a big one. Of course, the tongue and the jaw. So all these muscular effects, because the vocal folds can't adequately valve, if you will, the airflow and air pressure, they are being overworked and the system sort of jumps in to help. The type 2 is when there is actually a pathology on the vocal folds. So this is a compensation that's come in. And there's not really a fine line between which happens first. It's a little bit like the chicken and the egg. Sometimes people have an injury and then they develop this compensation very quickly, I have to say. I mean, I've seen people go on with a show with a very bad respiratory cold or something, some mild laryngitis, and within a week have developed a compensatory pattern. But sometimes it is a faulty technique or an inadequate technique or challenging repertoire that's sort of beyond the realm of the student. So it's, like everything with singing, there's always multiple variables, including psychological, which I will get to.
Yeah. Great. So is there a demographic or a population that MTD primarily affects, or do you see that there's a higher prevalence with singing certain genres?
Yes, all of the above. I think, and we don't have hard data on this. So these are just assumptions that I've found. These are assumptions I found working with other experts such as Dr. Kaidar in the field. There clearly seems to be an inclination towards the higher voices. So that's part of the technique of singing higher notes if they're not changing the registration or airflow, air pressure, that they can be sort of staying in overdrive, which can sort of lead to some aspects of the MTD. There is clearly a personality issue of which, and again, we don't have any hard or fast data, but it seems to be, more of a female issue. We see that with nodules too. Again, more of a female issue, how much of that is personality and sort of wanting to please, and how much of that is sort of the different mechanism and having different balance of mode 1 versus mode 2. Mm-hmm. And so some repertoire is going to ask for greater pressure. So maybe some of the belters, maybe some of the tenors, but certainly just the higher tessitura in general. And I also think there's developmental issues. I often see this in voices in sort of a developmental transition. So if you think that voices reach their first stage of being fully developed at around 25, you often see these issues starting around that time. I have seen that, particularly with music theater singers that have been able to have basically their instrument is flexible. They're able to do different things. It seems fine. And then their voice sort of reaches their first moment of maturity. The larynx settles down. The ossification has started slightly more. And as a result, some of that flexibility, they can't do things the way they used to. So I often see it in these sort of stages of singers that used to be able to do things naturally, and then the musculature matures.
Mm. You mentioned the airflow and the air pressure. Do you know if it is more prevalent at, say, a higher altitude?
I haven't seen anything with that issue. That would be an interesting study for future research.
Yeah.
I think the issue really, say the long distance runners that train at higher altitudes to get more blood in their bloodstream, right? I think for singers, the issue is the efficiency of the valving. So, with MTD, it's too much pressure at too high of a pitch, basically. So the larynx can't sustain it. And then other muscles are sort of compensating. And again, sometimes the vocal folds themselves are injured. So that's another reason why muscles might compensate. The airstream to create more subglottic pressure. This is where we need to ask a singing voice scientist what they consider how altitude would hold back, how that would affect the sound. I think I would say send that to Ron Scher. I'm sure Ron would love to look into something like that.
Yeah, I'm fascinated by it because I grew up in Colorado. So, So how would a voice professional recognize or diagnose MTD?
Right. Well, I think this is where it gets tricky, that really they should get a medical diagnosis. But that's my take. We can say you seem to have some of the symptoms, but, referring them to an ear, nose, and throat's always good for confirmation. We shouldn't be making diagnoses. But that said, what you hear is usually sort of an overpressurized sound. The vibrato may be out of whack. It may be a little flat. You often lose high notes. You certainly lose any finesse in high notes, any soft high singing. Nat Haidar talks about, can you sing softly happy birthday to me? Or staccatis. I mean, I just think particularly the high voices should be able to manage staccatis. Think of it's part of the old bel canto approach, but that's a point where you have a firm closure without overpressurizing. And so I find those are a great diagnostic tool. And I tell my singers, even that don't like to perform them, and certainly, there isn't too many staccatis when singing music theater song, but it's part of your training and your regime of keeping your voice healthy and flexible. But all the symptoms, many of us would say the technique isn't quite right. So a lot of it is sort of good technique can correct it. Another word I use sometimes is too much bottom up singing rather than a balance of bottom up as well as top down, being able to bring the top voice down to have a balanced flow phonation. And, certain voices need more stability of the larynx. So at different stages, there's different needs of a voice. But usually the inability to do top down is sort of another aspect of it. When singers are only asked to do loud bottom up singing, it can, again, some people will sing like that and be fine. Others will be more affected by this. You can feel on the throat if the student is comfortable, to sort of see what you feel in that notch between the hyoid bone and the thyroid cartilage. There should be a space, or at least freedom. And what you'll see for singers that are singing with sort of a higher laryngeal position consistently is they can't. The first step is asking them to learn to reset their larynx. Okay, so different styles have different laryngeal heights. That's all fine. You want to just be able to get it back to a neutral state. And so that's the first thing to help them be aware of what's happening. But the other piece is that sometimes if it's consistently and only in a heightened state, it gets to what we call a locked larynx. And then we literally cannot get it to a neutral state, or it's much, much harder. So I think that's what some younger singers are able to keep their larynx in a higher position, and it works for a while. But again, as the mechanism ossifies and matures, for some, again, I have to keep saying for some, that is sort of an unsustainable directive.
Yeah. And so you had mentioned working the balance between bottom up and top down singing. Are there other ways that specialists address working with muscle tension dysphonia?
Well, usually people that have MTD are over supporting. So really over pressurizing and sometimes even over blowing their sound, their air. It seems counterintuitive, but singers always know something's not right. And let me say, singers usually feel this before even expert ears hear this. So that's why you always listen to your singers when they say something doesn't feel quite right. So part of this is really making sure that the support is organized and not overdone. And that's why making sure they're in the body, sometimes having them sit while singing, because actually, again, they're overdoing. Sometimes less airflow. I know it's hard to imagine, but when they're overblowing, you sometimes have to bring that back a bit. So addressing the support and really coordination of that, focusing on the positioning of the larynx so they can learn how to reset in a neutral place, and learning how to disengage the tongue and jaw so much from their production that they can make these sounds independent of the tongue and jaw, and the fact that the tongue and jaw can move independently as well. Mm-hmm. Again, it's a lot of things good teaching is already doing, and it could just be that these particular people are predisposed to this because of their personality, because of their voice type, because of their mechanism. So it's hard to sort of say, oh, you're going to have that problem. It's complex. But personality aspect, if I can go back to that, is this piece of people wanting to get it right. And so rather than practicing it 5 times, they'll do it 100 times until they're physically exhausted. Mm-hmm. And then as things digress, they keep doing more. Most singers, because of the personal nature of singing, do not like to sound bad. Mm-hmm. So they will do almost anything so that they think they're sounding good. And that's another piece. I was just rereading the article that Linda Carroll and I actually wrote, where we did a case study on this. Is this idea of learning to go for the perception, what it feels like, rather than what it sounds like.
Mm-hmm. Yeah, so important, but hard to do.
Very hard to do. And I think, again, this is why the maturity issue is a part of this, because as voices do mature and change, and often the MTD is the highlight voices whose the voice is changing. It may have more color and more depth.
Mm-hmm. Would a voice teacher need special training to work with singers that are diagnosed either with MTD or other voice disorders? Or should a voice teacher have special training?
I think they should. I mean, you mentioned singing voice specialist and vocology. I mean, we don't have any system in place, even for teaching voice. Mm-hmm. But it does trouble me when I see people that haven't done any sort of work in with an SLP or with a doctor are actively seeking out people with some of these issues. Some of it is just good teaching, and I'm sure some teachers, but I think a little bit of humility for us all. And that's why being part of a team, making sure that the singer has seen a doctor of some sort, which I know is difficult because of the expense, is the issue from the speaking voice rather than from the singing voice. That's why often, bringing in an SLP is really part of the team. When I did work at the Grapshite with Dr. Wu and Dr. Carroll, there are people that fit the portraits, these cases very neatly. But again, singing, there's so much individuality and differences among the singers that, working as a team to get the clues that are necessary, from laryngeal positioning to repertoire sung to the amount of time sung, a voice teacher can really bring to the table. Say, singing the tenor part in the Verdi Requiem, knowing how that could be very fatiguing for an amateur singer, just as an example.
Yeah. So in regards to a voice care team, can we discuss scope of practice, especially in regards to rehabilitation and manual hands-on treatment? What is in the scope of practice, particularly for a voice teacher?
So again, I think the laryngeal massage, I wouldn't recommend it unless you've done extra training. I don't certainly use it all the time. And we can all think of great teachers that probably address indirectly some of these issues without doing sort of that laryngeal massage. So I think always just err on the side of caution, err on the side of humility. Feel free to refer people out. Often singers might need just a few sessions with an SLP, just a few sessions with a singing voice specialist. And, ideally the voice teacher attends to, if at all possible, to sort of be aware of what's going on. And then that's further, that's knowledge for them as well. Just in case it's something in their studio that they're doing that might be part of the issue.
Mm-hmm. Great. What would be your recommendations for a listener who is struggling with muscle tension dysphonia?
Right. Again, I think the diagnosis is difficult. Where are you frustrated with your voice? Are you, which direction are you going? Who is listening to you and what are they telling you are all parts of the puzzle. It is tricky. Felix Graham, who's now Dr. Graham, and I, we've done 3 surveys on MTD, and part of the response was just people being so happy to have more information. So I think it always starts with more information. When is it just my voice being difficult, and when is it, no, this is something I'm physically doing that I could do differently? it is tricky. I think, a lot of singers stop working with their teachers once they finished college or graduate school. It's expensive. And I think that's a piece that singers need to keep having an outside ear, because the voice does change. It's natural. You would not expect, if you were a dancer, you would not expect to do the same things at 20 as you did at 50. You just wouldn't expect it. Or you would know you had to do a lot more work to do the same bit. And the voice is more subtle, but is every bit as dramatic, I find. And some repertoire puts more stress on the system. And, frankly, also holding your own teacher accountable. I sometimes hear students that stayed with someone for 4 or 5 years. For me, if there's not at least progress being made, then maybe there might be a better approach for you. And I say that to my own students. We're all being held to be accountable, quite frankly, much quicker than we ever used to be. And I think that's the economics of society. I think colleges are changing. So for me, it's interesting because it does hold teachers to be a little bit more accountable to make progress, and also students to be more accountable too. Are you really practicing? Are you doing mindful practice? Are you actually doing the exercises that were done in the lesson? Or are you just doing some old random exercises? I remember Barbara Doscher being frustrated that people would come to work with her and they would keep doing their old exercises. Every exercise should have a very clear, this is where I get in my soapbox, every exercise should have a very clear purpose. And both the singer and the teacher should be clear about that, so that singers aren't doing mindless work. And teachers shouldn't be afraid when students say, why am I doing this? There's multiple reasons why sometimes. But I think that's part of the accountability that can help all of us. There's no magic bullet. I keep saying there's lots of great exercises out there, and there's lots of ones that teachers make up and can continue to make up. But if you don't have the why of you're doing something, it's really a total hit or miss. And there's enough hit or miss in singing anyway that, trying to minimize that might be a goal.
Mm-hmm. A good goal.
We do the best we can. We don't see the instrument.
Yeah.
We see students once a week, if that.
Yeah.
That's, some of the demands in the music theater world are really quite extreme. I mean, high range, 8 shows a week, really dramatic.
Yeah. Great. So we're going to move on to my signature questions. What is some advice you would like to give to an aspiring young performer?
To find your own voice. And I mean that literally and figuratively. And technique is a piece of that. Obviously, you need a sustainable sound, but we need to hear you and your interpretation. It's a mind game when people are trying to second guess what the directors and everyone want. Really that strength of purpose, that this is who they are and this is how they want to say it, I think is sometimes lost. And again, it's that wanting to do a good job, wanting to please people. And it's good to be a good colleague, but it's an art.
Mm-hmm. What is your favorite quote?
I think of everything from Martin Luther King of this idea of freedom and hearing all voices, to someone like Stravinsky, who said he's the most creative when he's given the most restraints.
What are your favorite song lyrics?
I certainly always love Sondheim. I know things now.
Who influenced your teaching the most?
I think I certainly have to come back to Barbara Doscher.
Mm-hmm. What is something new about the voice that you learned this week?
I was just thinking through some of my lessons. For one student, it was feeling, and this was an advanced singer, coming back after having children and all, and just this feeling of what exactly is an open throat and how do we get there. Another student who had studied only classically but really likes music theater was going into the realm of the crossover work, which she hadn't done before. Just the broad range of where students are in their progress.
Mm. What is one item you could never live without?
Right now, I'd have to say my phone.
It's so true, right? Unfortunately.
Connection. But seriously, it might be my cup of coffee in the morning or my water to stay hydrated all day.
Mm. What is one thing that you still have on your bucket list?
To brush up on my languages, to come up with another theme for my own performance. I haven't done one for a couple of years, so I'm behind on that. Those are the two big ones. More writing. I should do more writing. Those are my to-do lists.
Yeah. What is the most delightful word you can think of?
Delicious. And I don't just mean I like to eat, but also sound, visual, artistic. I also think words that empower people and sort of the artistic vision.
Yeah. And what is your favorite book?
Well, I'm reading How Children Succeed. So that's pretty interesting. It's a lot about motivation and how different aspects of our life motivate us or don't motivate us, and how that's so complex to get a person's confidence, and their background and family can affect that. I think it's that, books that help people find their own voice of what they have to say. And we understand now culture, personality, opportunities, and experiences. They can all negatively or positively influence people.
Mm-hmm. What are you currently learning?
I think voice, I'm always learning. There is always new ideas out there for me, and it's coming up with how can we really study this objectively, and maybe not a quantitative analysis, but at least qualitative analysis. An thing I'm working on now is the commonalities in voice teaching. What do we, can we agree on a few key posts to be looking for? Trying to put together all these exercises into why are we doing them, and see if we can draw from their commonalities. I do a lot of work on mentoring and trying to understand that and what different people need for mentoring. It seems to be an important piece of our profession, and we don't have either information, or it's a bit of a hit or miss with people. And I've started 2 mentoring initiatives, both with New York City Nats and now National Nats. So trying to give more opportunities for people in that mentoring aspect. And with improving teaching in general, sort of a self-reflective practice, helping people become both better practitioners in terms of their own practice, as well as feedback from peers. I think that peer practice we can learn a lot from.
Mm-hmm. And what do you wish you would have learned sooner?
So many things. Oh, that's saying that youth is wasted on the young. Humility would be good. Youth has a lot of excitement and energy and drive, and some of that could be tempered with more humility and questioning. For me, things have just evolved the way they've evolved, and your learning is directed in these opportunities for new things to consider. So I think that in a way, the population I see in front of me now, what's changing? Well, there's more ensemble singing. There's a broader range of styles. There's empowerment on different cultural identities. Our students are changing, so trying to develop plans, curriculum, and understanding of these broader areas. It just feels like there's just, hopefully as a constructivist teacher, I co-construct learning opportunities with my students, and that means I have to keep learning. The field changes. Mm-hmm. And that's what our students bring to us. They bring to us these new questions, and it's not a threat to our expertise, but it's our expertise seems like it needs to keep growing. Yeah.
If the listeners want to get in touch with you, Jeanne, what is the best way that they could do that?
The best thing is to go ahead and write me at my TC email, which is jcg21@tc.columbia.edu. And I'm happy to answer email questions. And we can, if people want to chat more, we can set up a time to chat. I'm not in my office much, so it's best to email me first and actually make a plan to talk.
Great. Thank you so much for joining me and talking about muscle tension dysphonia and working through with me on all of our technical difficulties today. It's been such a pleasure to talk with you. Thank you for joining me on the podcast.
Thank you, Christine. Great questions. Really got me thinking too. So it was a learning opportunity for me today. Thank you. Thank you.
Thank you all for listening. If you enjoyed this podcast, please tell your colleagues, your students, and your friends. Please subscribe, rate us, and write a review. You can find us on Facebook at Lifelight Massage, and you can also check out my website at lifelightmassage.com. Please join me next week for another wonderful conversation on the visceral voice.